South Mississippi school districts continue to look into the best way to start the school year as the coronavirus pandemic continues.
Ocean Springs School District recently partnered with medical leaders from Singing River Health System to form that Medical Advisory Council. And this afternoon, the school board held a virtual meeting to hear what they could expect. And that meeting ended just moments ago. And joining us now with more about the importance of the meeting, Singing River Health System Medical Director of Pediatrics, Dr. Tyler Sexton. Dr. Sexton, thanks so much for joining us today. And it was an important meeting today, I know, and you shared your recommendations. Is Ocean Springs on track to start on time right now? What came out of the meeting, and what did you recommend?
Well, thank you for your time, and thanks for having me. It's a pleasure to be with you guys. Dr. Logan has been working with the advisory committee for a while, and I too myself being the chair of Singing River. And you know what? It was a great meeting. You know, you're always an expert until you tell somebody something they don't want to hear. And this is a hot topic. This is a charged topic. And we talked a lot of things. We talked about our increase of seeing mental health issues with our children. We're trying to find ways to make sure that they're safe in the schools and how to do that. And not only the children, but also keeping our teachers safe. They're the backbone of this crisis in terms of getting our kids back on track. We've taken a lot of hits with virtual schools. You know, we're trying to allow them to have the option to go to virtual schools, but we see the importance of in-house or face-to-face education and what that means to our kids and to our teachers with the needs of their needs physically, meaning with needing meals and resources. So we talked about ways to make sure that they're safe. We talked about ways to look at mitigating risk and reducing cohort sizes and what kind of things we're going to put in place at the schools.
Dr. Sexton, need kind of a quick answer here because we have to go to break and we're going to be back with more. What would you say to parents, teachers, and kids who are scared right now?
I would say this. I would say that we are doing everything we can do to minimize the risk, to make sure that these kids are safe and that we have the utmost opportunity or the desire to keep our kids safe and our teachers safe.
And Dr. Sexton, 185 cases in Jackson County today, and the COVID numbers just keep growing. Some districts are actually pushing back until after Labor Day to start school. Do you see any need for this right now here?
You know, I will tell you that most recent data that I have collected today, when looking at 19 years old or younger in Jackson County, and what Singing River Ocean Springs has done was 151 cases of positive tests for the 19 and below age range. So yes, as cases do increase, there's going to be a risk. I think that the benefits of going back to school in terms of socialization, in terms of the mental components on these children and kind of the struggles that they're having in terms of there's nothing normal about what any of us are going through. And I know that there's a lot of angst, uncertainty that goes along with all these children and their parents, and the right for them to choose what's best for their family is important. But it's also important to know how important face-to-face school is. And so, yes, there needs to be a way for us to mitigate those risks and to reduce those risks, and hopefully we can help control some of that spread, but also knowing how important school is to let them achieve the next level of education is so critical, and that's what we're trying to balance. Healthy protocols and healthy fears. I'm not disengaging or disregarding anybody's fears with it, but also how to do this in a sense of normalcy and safety, because COVID-19 is not going away. We have to find a way to work with it, to come around to work with these kids. And thankfully, in the pediatric population, it's a lot less severe in terms of the presentation of this illness in pediatrics. And we want to try to protect our children, but also protect our teachers that are so critically important to these kids.
All righty. Dr. Tyler Sexton, thanks so much for being with us on the 4 o'clock show. And school, again, is right around the corner.